things that's really important is that students who are experiencing difficulties at the higher level is that they really need a full evaluation to look at all of their strengths and weaknesses, to figure out not only where they're having a hard time, but what they're good at. So in this way we can say, oh, you know, maybe learning by memorizing long stories or memorizing long lectures is not the way that you learn best, but chunking things in short pieces, or you're really a visual learner, not a verbal learner, or maybe you have deficits in visual spatial skills or visual learning, so you can learn to talk your way through it because your visual memory is really great. So the idea is that if you go in and you meet with somebody for 45 minutes and you do a couple of checklists and you say, you have ADHD, or it sounds like you might have dyslexia, it's really hard to put together a full academic program. Most people are fairly complicated. So if you have one of these full evaluations, we can really put a practical plan in place for you beyond just the idea of getting something like extra time. Extra time is great, but not everybody needs extra time. Maybe somebody needs help planning their schedule. Maybe somebody needs books read aloud to them. They need to be able to tape lectures, that sort of thing. And the idea is we want an assessment that's a quality assessment, not something Dr. Cronin and I have seen where you can go onto the internet and pay $100 and you check some boxes and they spit something out to you. It should be something where a history is taken, there's an interview, there are quantitative assessments used, there are qualitative assessments used, and everything is put together in this big picture. And I would say one of the things we were talking about earlier is intersectionality. And this is where a lot of this becomes really important, because one of the things that we see at the medical school here at Mount Sinai is that a lot of the students who come from wealthy backgrounds or have higher socioeconomic status have had these types of evaluations for years. And so they come in knowing exactly what they need. And then we have other students who come from a lower socioeconomic status who have never even heard of some of these so-called invisible disabilities. Or they think, well, you know, I'm pretty smart and I've been able to get by, so I don't have anything that needs a diagnosis. I'm just struggling. And they're putting something on themselves when they could be getting help.